Hi, we are here from Lee Health. My name is Teresa Summe and I am the manager of the Asthma and COPD Management.
My name is Robert Seifrit and I'm one of the asthma and COPD education specialists.
We are here to talk to you about COPD and give you some tips. There are approximately 16 million Americans with a diagnosis of COPD. That is according to the CDC. So Rob is going to give you some tips to help you during these unprecedented times and help you stay safe and keep your breathing under control.
First of all, I think it's really important for anyone who has COPD just to remember to make sure you have enough medications on hand, both your rescue medication and your controller medication. The rescue medication is your albuterol in the form of a metered dose inhaler. That's with the actuator where you spray and squirt the medicine into a spacer, or you have the nebulizer solution of albuterol. So please make you have an ample supply of that in the event that you might need it. Also, make sure you have your controller medicine, and that's that medicine that you take every day to prevent your COPD from flaring up. And it's also important to remember to do pursed lip breathing if you get a little short of breath. So what I'm gonna do, just as a reminder to teach everybody, I'm gonna have Teresa do the actual technique of pursed lip breathing. So I'm gonna explain to her how to do it. So she's gonna breathe in through her nose and out through her mouth, and I'm gonna explain how to do that right now. So what Teresa's gonna do is she's gonna slowly breathe in for about 1 to 2 seconds through her nose, and then she's gonna breathe out through puckered lips for 2 to 4 times as long as she breathes in. And notice when she's doing that, what it does is it pops your airways open inside and allows the extra air to exhale. She's gonna slowly exhale and then slowly inhale again through her nose, and then slowly exhale through those puckered lips, remembering that it's 2 to 4 times longer than you breathe in, okay? Another tip for patients is we really encourage everyone to use the COPD action plan that your doctor has given you. And it's really important to be cognizant of what that plan entails. So we have a COPD action plan right here that I'd like everybody to see.
And Teresa's
this is from Lee Health. So on this action plan, you'll notice it has a green, a yellow, and a red zone. So green is your go. That's what you're gonna do every day to prevent your COPD from flaring up, what medications you take, what oxygen you may or may not be on, and what controller medicines you may be taking as well. And also you'll notice in this green zone, it's your feeling well is on the one side and what to do is on the right. So on the left side, feeling well, meaning you're getting your usual amount of activity in, you're sleeping well, you have usual amounts of cough, and it also brings on, you have a usual exercise level as well. So whatever your normal exercise level is, so that's your feeling good zone. Your yellow zone is gonna be your caution zone. That means that your COPD may be flaring up. So some things to look for, especially now, if it's off your baseline, which is your green zone. So you get a little bit worse than what you typically feel. So you have increase in phlegm production, more coughing, you're not able to do as much activity as you'd really like to do. In addition to that, it says more coughing than usual, and I feel like I have a chest cold. So it's really important to be in tune with how you're feeling. If it is off your baseline and you do have some worsening of symptoms, on the action side, whatever you and your doctor have ordered, if the doctor said you need to take your rescue medication, which is the albuterol, every so hours during a flare, that's what you do. And just remember, you also have a red zone on here. And what that red zone here is if you're in this yellow zone and you're taking whatever rescue medication your doctor has prescribed for you, if you suddenly feel worse, meaning you have a dusky type color on your face, you're having severe shortness of breath at rest, or just having trouble talking in complete sentences, not being able to sleep because of your breathing, and you might even have a fever or experiencing chills. So it's really important, if you get worse like that, to please seek emergency medical attention. I think this is important to mention because not everyone's going to the emergency room when they really should. If your COPD is really flaring up, it's really important that you go to the emergency room at your local hospital.
Make sure you call your doctor too. Like he's saying, anytime you're having any symptoms that are not clearing up with your basic action plan, and make sure you remember what is your baseline. That was a really important thing that you emphasized.
Thank you. Yeah.
Always remember, we at Lee Health and Asthma and COPD Management, we care about each of you and we are here for you. Please reach out if there's anything at all you need, just any questions or suggestions. Thank you.
Yeah, thank you too.